Did you know morning sickness can sometimes become so severe that it's life-disrupting? That's Hyperemesis Gravidarum. Hi everyone, I'm Tejan, your midwife here at Midwife Doodle. Today, let's talk about something that so many pregnant women experience, that queasy, not so fun feeling known as morning sickness. But did you know that for some moms, it can become much more than that? We'll explore the difference between regular morning sickness and a condition called Hyperemesis Gravidarum, which occurs when nausea becomes severe enough to require hospital care. Everything I share today is for educational purposes only. Remember, always consult your healthcare provider for advice that's right for you. Morning sickness is common. It's that mild nausea or occasional vomiting that happens early in pregnancy, usually between 6 and 12 weeks. And despite the name, it can actually happen any time of day. In fact, about 70 to 80% of pregnant women feel some level of nausea. It's mostly due to rising pregnancy hormones, especially HCG and estrogen, plus a bit of extra sensitivity to smells and tastes. Those hormones, HCG and estrogen, act on the part of your brain that controls nausea and vomiting. It's like your body's adjusting to all the changes of early pregnancy. Stress, tiredness, or an empty stomach can make it worse. But if it's mild, it's usually just a normal sign that your body's supporting a growing baby. With morning sickness, you might feel queasy, maybe vomit once or twice a day, but you can still eat, drink, and stay hydrated. You're not losing weight, and you're able to keep food down, even if you have to nibble throughout the day. Now, Hyperemesis Gravidarum, or HG, is a whole different story. This isn't your regular morning sickness. It's severe, it's persistent, and it can cause serious dehydration and weight loss. According to the World Health Organization, HG means constant vomiting that leads to dehydration, loss of more than 5% of your pre-pregnancy weight, and changes in your body's chemistry. It affects about 0.3 to 3% of pregnancies, so it's rare, but it's tough. Here's how you can tell the difference. With morning sickness, you might feel rough, but you can manage. With HG, you can't keep anything down. You're vomiting all the time, even on an empty stomach. You feel weak, dizzy, maybe your urine looks dark, or you hardly pass any at all. It's your body's way of saying, hey, I really need help. Now, here are the red flags you shouldn't ignore. Vomiting everything you eat or drink, hardly any urine, or dark-colored urine. Losing weight, feeling dizzy, dry, or faint. If this sounds familiar, it's time to see your healthcare provider right away. Dehydration isn't safe for you or your baby. We're still learning why HG happens, but we know it's linked to high HCG levels, twin or multiple pregnancies, thyroid changes, and sometimes family history. So, if your mom or sister had HG, your chances may be a little higher. For mild nausea, the good news is there's a lot you can do at home. Try small, frequent meals. Avoid strong smells or spicy food. Sip water or herbal tea slowly throughout the day. Ginger, peppermint, and rest can make a big difference. Simple steps, but they really work. With HG, you'll need more help, and that's okay. Treatment usually means intravenous fluids to replace what you've lost. Maybe some safe anti-nausea medicines prescribed by your doctor, and sometimes nutritional support if you can't eat. And don't forget, emotional support matters too. HG can be lonely and exhausting, so having kind care and reassurance makes all the difference. Recovery takes time, but with the right care, most moms feel better by the second trimester. We keep an eye on hydration, weight, and the baby's growth. And remember, this is not your fault. Your body's just reacting strongly to pregnancy, and you're doing an amazing job getting through it. So, here's the takeaway. Morning sickness is mild, manageable nausea. Hyperemesis is severe, ongoing vomiting that needs medical attention. Both are real, but one needs more support. So be kind to yourself and reach out for help if you need it.